Hi, I'm Dr. Heather Franzoni-Stratton.
And I'm Dr. Kim Blakesley.
And we're at HPS Advanced Dental Care located in Shelby Township, Michigan. We wanted to answer some questions, commonly asked questions from our patients. So the next question that we get often is, I have a lot of sensitivity to cold. And lots of times people will call or come into the office, say, oh my gosh, my teeth are really cold sensitive. Do I need a root canal? Typically, the good news is you rarely need a root canal when the tooth is just sensitive to cold. Typically, sensitivity to cold is sometimes from a cavity. You might have a little cavity in your tooth. Oftentimes, it's because you have some gum recession. And when your gums recede and you can see the root of your tooth, that oftentimes will lead to some sensitivity to cold. What I often tell the patients is, we know our enamel, which is the part of your tooth that you can see, is about 98% mineralized. The root surface is only about 55% mineralized. And what that means is it's just not as strong. It's just more porous. And because it's more porous, when we put something sweet or cold on that root surface, it feels like the nerve's exposed. The nerve's not exposed, but it feels that way because that sensitivity is going straight to that nerve, sending that impulse to the nerve, and the tooth says, yee, get the cold or the sweets off my root. And so oftentimes what needs to be done is we can put a little filling material up on that root surface. Sometimes we can just put a little remineralization agent onto that root surface to help remineralize that area so that it gets stronger. But we have a lot of different options. So if you have any other questions about what to do if you have sensitivity to cold, please call our office, 248-652-0024.
Another question that we hear a lot, especially with newer patients, they'll come in and they say that they wake up with a headache, their jaw is sore, they can't open wide, and usually that's a sign that they may be doing some type of clenching or grinding, and it's a lot of times that it is at night and they're not even aware they're doing it. And sometimes it's due to stress or, just lifestyle, and a lot of times they also have seen a chiropractor or some type of physician for their headaches, and they continue to occur and they are confused as to why. So what we recommend to patients is what's called a bite guard or a bite splint. And a lot of times people do have them and they buy it over the counter, but usually if we have them custom made for them, it'll help a lot with their headaches and alleviate the migraines that might be related to the headaches. And people don't usually realize it, but it is something that's highly related, headaches and clenching and grinding. So if you have any questions about that, or we can help you with treating your problem with migraines or clenching or grinding, please feel free to call the office at 248-652-0024.